Hi, my name is Dr. Melissa Carr, and I'm a doctor of traditional Chinese medicine in Vancouver, British Columbia. And I thought today I would try to explain to you a little bit about how to use press needles. So some of my patients, I've been sending press needles. It is not possible for me to work in clinic face-to-face right now with the COVID-19 pandemic. And so I've looked for tools of ways that people can do their own treatment at home. So this is just a little demo on using the press needles. So I'm going to show you, if I've sent you some press needles, they are 0.3 millimeters long, the orange ones, 0.6 millimeters long, the yellow ones, and maybe I've given you the 0.9 millimeter long ones, which are the green ones. These are the ones that I typically use. There are 1.2 millimeters and 1.5 millimeter options as well, but I stick with these ones at less than 1 millimeter long. They don't go past the skin level generally, and they are easy to dispose of, easy to use. The 0.3 and 0.6 are, they're not going to be painful to use as well. You're not going to feel it sharp, pokey. And the key to it is that when you're using it, that it doesn't feel sharp and pokey to you. Once you know what location you're going to apply the press needle, you've got the directions for that from me. You're going to grab a press needle like this. You'll see that it's kind of like an egg shape there with the skinnier end on the top. You're going to use that as up, and then you're going to pull back the wrapper at the just on the top part of that. Okay, so you'll see that there's a little sticker there that allows me to grab that part of the sticker off without touching the sticky part itself. You'll also see on the other side that it's a little bit of a bend mark there. So I'm going to bend that back, and when I bend that back, it's very easy for me to grab the sticker here. Okay, so again, I'm holding on to the backing of the sticker, not onto the sticker itself. That's what it looks like from the other side. So just as a close-up on that, perhaps you can see there's a little bit of a bump where the tiny little needle is held, and that's the part that's going to be on the outside. So the other part, the sticky side, is where the tiny little needle is going to be sticking out. I'm going to show you the placement of an acupuncture point here first. So the placement of this one is pericardium 6. This is a really good one for nausea and hiccups even as well. We call it stomach energy going up. Stomach energy should always be going down. If it's going up, we try to adjust that. So from the crease of the wrist here, I'm going to go 3 finger widths, these 3 fingers, index, middle, and ring finger, from the crease of the wrist. And then on the other side of that, between the tendons. So you'll be able to see as I pop my wrist like that, be able to feel and see that there are tendons there that are sticking out. So I'm going to use that as my point. What might be easier to do is if you have another set of hands that can mark that out for you with a pen. So once you know where it is, you can X on it with a pen. I know where the point is, so I can easily apply. What I'm going to do is once I've picked the point, I'm going to put the sticker on. Okay, I'm going to check to see, is it pokey? Is it bothering me? Because I can squeeze it hard, so you can see I'm squeezing quite hard here. Doesn't bother, it doesn't feel pokey, doesn't bother me, and whatever. I can also see that it is in between the tendons, so that I'm not on a tendon. And so I can see I've got the right point. And in fact, I can also measure it out again. So from where the protruding part is, on that, where the needle is, I can actually remeasure out again and see that I've got the right location. Once I've got that right location, it's not pokey, and I'm happy with my placement, I can remove the backing. Now, if I were unhappy with the placement, I can actually use that backing, lift it up again, reposition it a little, and give it another go. Okay? So don't do that too many times. You'll obviously make the sticker less sticky, but once you've got it there and you're happy with the placement, peel off the second part of the backing, and then you can stick everything down flat. Okay, that's how you put the press needle on. So just one more word regarding if you're not sure what size you're going to use. Generally, I use the 0.3 ones for anything that is sort of more shallow. So that there's not, so sort of the halfway through the upper arm down. I might if I were a smaller person, I might even do some of the other points, the 0.3, or more sensitive if you tend to be more sensitive as well. Then I might even choose up to the elbow as the 0.3 millimeter. On the leg, I would use 0.3 around the ankle. On the foot, the hands for sure, 0.3. And then 0.6 I would use for like the rest of the arm or the rest of the leg. I might use the 0.6 on the back, the torso. If I were using on the glutes, or if there's less sensitivities, I might use the 0.9 millimeter long one. So if you're unclear about that, you've received a press needle kit from me, feel free to let me know. I'm happy to answer. And I hope that helps explain how to use this. If you have any questions, give me a shout. Again, my name is Dr. Melissa Carr. I am a doctor of traditional Chinese medicine in Vancouver, BC. My website is www.activetcm.com. I'm happy to answer any of your questions. Thank you.